Through a $1 million opioid settlement fund, the city of Holyoke was able to award 5 nonprofits and community partners working to address the impacts of opioids. 22 News reporter Sarah Baname joins us live in studio with which organizations were chosen and how much was given.
Christina, after recommendations, community input, and findings from the city's opioid community needs assessment, Mayor Joshua Garcia chose to award nearly $100,000 to $400,000 in grants across Holyoke. Attorney generals across the U.S. sued Big Pharma for fueling the national opioid crisis. So through a massive multi-billion-dollar opioid settlement fund,
the mayor has been on the streets talking to folks who are unsheltered in the throes of addiction.
The city of Holyoke was one of many communities across the U.S. to receive nearly $1 million from the settlement for opioid treatment, prevention, and recovery efforts. Over the last year, the Office of Community Development did a series of forums on how to allocate the money for the first round. Out of 12 applicants, 5 organizations were chosen. Mass Hire Holyoke,
for the ambassador program and getting folks gainfully employed.
The Holyoke Medical Center,
where we'll be funding a recovery coach in the emergency room.
The Holyoke Board of Health,
to address harm reduction.
Tapestry Health.
They do a lot of work with folks who are both unsheltered as well as in the throes of addiction.
And Providence Ministries.
One of the things about the 5 projects that the mayor selected for funding is that they are across a spectrum of services. And so Providence Ministries is what I would describe as our sort of entry-level servicer. So those folks are going to be working with people that are currently unsheltered on the streets.
And I wanted to see for myself how the grant would benefit Providence Ministries.
It allows us to strengthen and better coordinate the work that we currently do. We serve a lot of this population already. So they come through our doors for meals, they come to our doors for pantry service, for clothing, and also just in the front, we serve the unhoused and individuals on a regular basis.
Once the individuals take this first step, the city hopes the grant recipients work together to move the individuals forward to a healthy and sustainable life. The progress of each program will be posted on the city's websites.
We wanted to make sure that our program was inclusive, that we were hitting every corner of the community. Folks that are impacted by opioid use are not necessarily just the folks that you see on the streets.
Before the next grant cycle, the city has to make sure the projects are consistent with the state subdivision agreements guided by the Massachusetts Attorney General's Office and the Massachusetts Bureau of Substance Addiction Services. Working for you, Sarah Baname, 22 News.